and Dr. Ara Dikmajian performing live spine surgery here at the Duke Spine Institute on July 11, 2023. Our patient has traveled here from far, the Cook Islands, I keep saying Cook Islands, which is apparently, I've never been there, but they're somewhere over south of Hawaii, near Australia and New Zealand. Okay. 3,000 kilometers, I'm being told, away from Hawaii. So he's traveled very far, and he's here because his back's been killing him. He's got some leg symptoms as well, and we're going to fix his back pain today. You can actually see on the x-ray, Jordan, show us the disc herniation there. Henry, can you see the herniated disc on the x-ray? It's a bit calcified. It's been there a while, so you can see it's getting dark on the x-ray, meaning that it's radio, it can be seen on the x-ray with the radiation. All right, the AP looked good. We're about to enter this first disc. Shot, 4-5. Today we're going to be fixing L4-5 and L3-4 discs. We're going to follow that up with the DPR for facet pain at L4-5, L5-S1. I'm making my incision right here, and one of the things we do to minimize skin bleeding is we use epinephrine, but lately we've stopped using it because we found that it actually increases the heart rate and blood pressure, and we don't want that happening, so we've stopped using the epinephrine shot, and instead we're going natural with just some numbing medicine shot. All right, targeting the next disc, which is the L3-4. There's another herniation there. Let's get an AP. So I'm putting a little bit of pressure on the skin edge to reduce any bleeding. Tell me when you're getting ready to shoot. If you have questions, feel free, shot. Okay. If you have questions, feel free to ask us those questions during the surgery. So on the AP view, I'm pretty far away at L3-4, shot. On the lateral view, I'm pretty far away as well. So it kind of works out pretty well. Shot. Shot. Looking good. Shot. Looking good. I feel the herniation, by the way. Shot. All right, we're right there at the back of the disc on the lateral view. I'd like to get an AP, which is a front back, and make sure that we're where we're supposed to be. Shot. Perfect. It's the exact spot we're supposed to be. Right at the back of the disc, you can see the mid-pedicular line between 3-4, and the disc is pretty degenerated, but we're going to go in there and fix it anyway. Dr. Berndez, we are ready for our patient to be awake. Shot. So this disc is pretty collapsed here at 3-4, but we're in. Okay. Now, if he's not awake, let me know. We'll just go straight to the DPRs. All right. Let's go to AP view. We're going to go straight to the DPRs. Now, we're doing his L4-5, L5-S1 facets. He has facet joint pain.
Okay, he's waking up nicely.
Is he completely awake?
Yeah. How are you, my friend? You okay? Can you open your eyes? Perfect.
As in
some questions, okay?
discogram time?
He said yes.
Okay. Let's go back to a lateral view.
You're going to give us a pain score 0 to 10, okay? 1 to 10, sound good?
He's like, no, it doesn't sound good. Why would that sound good, Dr. Berndez? I don't want to be in pain. All right, how long has this gentleman had back pain? 10 years. 10 years. It's a nice round number, but it's a long time to have back pain. And I'm going to have Henry roll a video in a moment that will show you why people get back pain. But when I ask him, where is your back pain? It's in this area here, his lower back. And we have two discs here, the number L34, L45, that on the MRI they're definitely damaged. L5-S1 looked pretty good. And then I asked him, what about pain off to the side here? And he said, yep, I've got pain in these circles here. And when I pushed on these areas, they were really tender. Well, these are your facet joints, the L45 and the L5-S1. So we're going to be treating not just his disc pain, which is central, but also his facet joint pain on both sides. Are you comfy?
Are you comfortable, sir? Hey, my friend. Are you comfortable? He said yes.
All right. Any pain?
Are you having any pain currently? Are you having any pain? No.
How bad is that on a scale of 1 to 10?
Give us a number.
How high does that number go?
I gotta hear you. Speak up. 10? Say it one
Was
more.
that a 10?
What number? What number was it? I'm sorry.
How bad was the pain?
10.
Is that where you get back pain?
You said yes.
All right. So L45 was a 10 out of 10 pain, and it's concordant, meaning it's his typical pain. Show us the tear in the back of the disc, Jordan, where the back pain is coming from. Yes, that's it. So we're going to go in and repair that tear. Is it better now? Any pain? He said no. By the way, when I injected the dye into the disc, you could see his back arch. If I were to inject a painless disc without any pain, a normal disc, there would be no arching of the back, there'd be no back pain. So the fact that he's responding when I inject tells me that it is a painful disc. Are you comfy?
You okay?
How bad is that on a scale of 1 to 10? How high?
What'd you say?
How high did it go? What's the highest?
10? 8.
All right. Is that where you get back pain?
Is that where you normally get the pain? Keep your arm still.
Is that where you typically get the pain? Show us the tear.
You keep your head still.
Yeah,
Head still.
right there. All right. So at L34, there's a posterior tear, and it's causing 8 out of 10 pain for him. Concordant. Wow, you see all that dye just squirted out? Pretty cool. All right, he gets to go to sleep. When he wakes up, all that pain will be gone. We're going to put you to sleep. Can you count from 1 to 100? So our discs were 8 over 10 at L34 and 10 over 10 at L45. We got the American flag colors, red, white, and blue. And we're ready to get started. Our shot. Guide wire is in place. Taking the needle out. We're going to bring the dilator down. Remember, we already made the 7 millimeter incision to accommodate the endoscopic tube. So here we go. Let's do a little num-num. And while I'm entering the disc with the dilator, my anesthesiologist, Dr. Berndes, is putting our patient to sleep. Luis, did you ever get your final results?
6 weeks? Yeah, it's negative.
Negative. Are you warm?
Huh?
Are you warm? I see sweat on your forehead. Are you hot?
No, I'm good.
Do we need to cool the OR?
No,
What's the temperature on the wall?
should be 65. 65. Yeah.
So Orlando will be 62. if we want it. Can you make this colder, or is this as cold as it gets?
No, no, no. You can make it colder, but I mean, it's
So
your
it's about
cake.
the same. No, I'm comfortable. I'm just worried about you. Okay, we are in the disc. We went through the tear. Henry, why don't you show our audience why do discs actually cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. You've seen now from our video why a herniated disc in the lower back can cause so much back pain. It's all coming from inflammation inside the disc, specifically in the back wall of the disc, called the posterior annular tear. It's a very pain-sensitive structure. The pain fibers that are located in the posterior annular wall are transmitted to the brain, to where your brain perceives that pain as being highly localized to the lower back. We call that the somatotopy organization of those fibers. They're somatotopically organized so that the pain signals go to specific region of the brain that you have awareness that that area where the pain signals come from is your lower back. So it causes back pain. And that's thanks to what are called sensory association areas, where your brain will associate the signals that come to the primary somatosensory cortex with your lower back. It's quite fascinating. There's two types of pain. There's pain that makes its way to your consciousness, that's localized. There's pain that's subconscious and doesn't go to the conscious centers. It stays in the subconscious centers. The pain that comes from a herniated disc goes to the conscious awareness centers, called the primary somatosensory cortex, which is part of your cerebral cortex, which is part of your, what we call the neocortex, the new part of the brain, as opposed to the archicortex and paleocortex, which are very old parts of the brain, meaning they were there long before the neocortex. Cortex, of course, is the part of the brain where you have neurons sort of on the outside that receive inputs from other parts of your body, from other neurons, and it's involved in what are called higher processing functions, okay, where you basically make associations to those impulses. to certain feelings or areas and experiences. For example, if you're driving your car home today and you see something with two focal points of light approaching you off to your left side that has a shape associated with those lights that's large, rectangular, and it's moving directly towards you on a surface that's black, you might say, hey, there's a car in the other lane heading my way. And you'd be right. See? But the ability to recognize those visual shapes of rectangles and lights, round tires, pavement, that comes from other parts of your association cortex that associates a meaning to those shapes and to that pattern of movement. The brain is quite fascinating. As a neurosurgeon, we're trained to understand the brain, how it works, the different parts of the brain, their function, their role, processing information, distributing commands, and of course operating on the brain when need be. I haven't done much brain surgery in many years. Somebody asked me that today, when was the last time you did brain surgery? It was a long time ago. It was probably 8 years ago. Right, Luis?
I believe so, yeah.
Because we focus mainly on spine issues now, and I don't really treat people with brain issues anymore because we're so busy with spine. But brain surgery is kind of like riding a bicycle. You never forget how to do it because you've done it so much under such emotional circumstances, right? Like when you're learning how to ride a bike, you're scared you're going to fall, so you're under great emotional duress while you're learning. I remember. And it's one of those things that you master so completely that even if you haven't ridden a bike in 20 years, you can still hop on a bike and ride. Your brain remembers how to do it. Same thing happens with neurosurgery. As long as you learned it right the first time, then coming back and doing it later on, even after 10 years of being away from it, a good neurosurgeon can still do brain surgery and save someone's life. It's not that hard. Hey, it's just brain surgery. All right, Henry, do we have anybody questions?
We have a couple comments and a question.
Sure.
And this first comment comes from, forgive me if I'm pronouncing it wrong,
That's quite a name.
Civi on YouTube.
All right, Civi on YouTube, welcome.
They asked, I have a arthritis on facet and have done facet block and a rhizotomy, but not much has happened. I still feel some pains in my lower back.
We can get rid of your pain, Civi. We're going to do a procedure here next in a few minutes, probably in about 20 minutes, where we're going to treat this patient's facets with a new treatment that you need for your facets. It's called the Duke plasma rhizotomy, and it's a permanent destruction of the facet joint nerve called the medial branch of the dorsal ramus.
The next question comes from...
So my advice
I'm
is
sorry.
stick around and watch that surgery be done. Sorry, go ahead.
No problem, no problem. Next one comes from someone else on YouTube. And someone else said, please tell us, as we are watching the video, where is the nerve root nerve root, and where is the disc?
Sure. Yeah, we are inside the disc. So you guys see this metal tube here, the end of it where the laser is? The laser is inside the tube, now it's outside the tube. It's inside the tube, and now it's inside the disc. This is the annulus right here, all the way down to here, okay? And it's been torn, and you can see calcium right there. It's just in a wretched shape. It's been herniated, it's been torn, there's been inflammation going on in here for a very long time. And the inflammation has destroyed this annulus, this disc. Here's some herniation. Everything okay, guys?
Yes.
So, I'll show you the nerve root in a moment. I can't show it to you right now, but I'll show it to you when I'm done. That's the best time for us to see it, when I'm done. This is the annular tear. This is all part of the disc, the outer wall. And right up there is some fat and the epidural space. You guys see that?
Yes, we do.
All right, this is the last of the herniation right here. So I'm using my laser to get rid of it. And all the scar tissue from chronic inflammation. It's the white stuff. Mostly scar tissue. This was where his pain was coming from. This area that I've cleaned out. All this stuff here that I've cleaned away where there's a hole now, that was the herniation and the annular tear. It's all gone now. So there's the exiting nerve root. It's going to be to the left at 9 o'clock. And what we call the traversing root, it's going to be at 12 o'clock. Right where the laser is. Just behind that metal. Behind my tube. Okay? So the traversing root is going to be up there behind the tube. And the exiting root is just to my left here. I'm not ready to show it to you. I got to clean a little more of this herniation out. Now, why didn't this herniation that's white here, why didn't it stain blue? The answer is simple. Because it's so old that it doesn't even stain blue anymore. It's all scar tissue. And scar tissue will not stain blue. Only the herniated nucleus that's degenerating will stain blue. This is bone spur. See how easily we got rid of the bone spur there? Scar tissue inside the disc. Now we're not going to get rid of all the scar tissue. It's not possible. All we can get rid of is the stuff that's causing the pain in the back. It's taken me a long time to figure out which stuff to remove and which stuff to leave. Okay? But that's what I've learned. Okay, just about done. One more minute here on this disc and we'll be done. Okay? Then we're going to go to the next disc, and then we're going to treat the facet joint pain. For those of you that have ever had medial branch block or radiofrequency ablation, RFA, okay? Those surgeries, those procedures are done all over the world. They're done to treat facet pain. They're the treatment, the best treatment there was. Then Duke Spine Institute created a new treatment called Duke plasma rhizotomy. And with the Duke plasma rhizotomy, we're able to deaden the pain coming from the facet joint or the sacroiliac joint or the knee, soon the hip and the shoulder. We're able to deaden all that pain without doing major surgery, and we do it permanently. Okay, we're going to show you how we do that in a minute. So if you have facet pain, you've done an MBB or RFA at work, but it came back, the pain came back, this is the procedure you want. But you're not going to get it done anywhere else but Duke Spine, because that's where it came from. We pioneered that treatment. All right, I'm done here. Let's have the grabber. Damn it. Yeah, that's what I thought. still a few pieces of herniation stuck in the back of the tear in an area we can't see. I always finish my surgeries by grabbing back here to see if there's anything there, and there was. So it's a good thing we did. Those could have caused pain. I don't have any more now. That's it. We're done. We got one more disc to do, and then we're going to go to the facet joint treatment. I'll show you guys how we're doing that in a minute. All right, so I'm going to start with putting a little antiseptic called betadine, and we're going to clean it out. Any questions, Henry?
Yes, we have 2 questions. This first one comes from someone else, once more on YouTube. And they asked, if the herniation is in the center and push the spinal cord, how do you decide from which side you will enter?
Great question. So, first of all, there is no spinal cord in the lower back. So, to answer your question, you must be either in the neck, cervical, or thoracic spine. That's where the spinal cord is. And if it's in the middle and it's cervical, we're able to get it because I can see from side to side across the back of the disc, and I can remove the herniation. If it's thoracic and it's in the middle, then I would recommend going on both sides. And if I go on the right side, I can do the right side up to the middle. If I go on the left side, I can do the left side up to the middle. So I would be able to get the whole back of the disc with both sides in the thoracic spine. But if it's cervical, I only need to go on one side. We've done it many times. It's very easy to do. There is no spinal cord in the lumbar spine, so we don't need to worry about in the lumbar. Now, I do go on both sides in the lumbar if the patient has radiculopathy on both sides. Shot? In other words, if they have shot leg symptoms on both sides in their lower back, then I will go on both sides to do the surgery. I always go on the side of the leg symptoms or leg findings of weakness, numbness, etc. Luis, there's something in here, I think. Blocking. Okay. Great question. Shot? Huh? Any more questions?
Yes, we have a question from Mohammed on YouTube.
Hello, Mohammed.
And
Welcome to our live stream.
they asked, what is a facet joint?
What is a facet joint? Well, Jordan, show him now where the facet joint is. The disc is in front of the tube. Show us the disc. There is the disc, the whole thing, front to back. Show us the facet. There it is. There is the facet. You see the line there? Go down a little bit. There, more. And stop. That line there and up to the tube. Go up and down, right there. That is the facet joint. Okay? It's in the back of the spine, behind the disc. Does that make sense? So 10% of back pain comes from the facet joints. 90% comes from the disc. This patient has both. He has arthritis in his facets, and he has pain in his disc from a tear, the annular tear. So we have to fix both, the facet and the disc, if we want to get rid of his pain. So he agreed to do both. He did what I recommended. So right now we're fixing the discs, and in 10 minutes we're going to fix the facet joint. Both sides, L4-5, L5-S1. You'll see it. That's it. Okay? How was the patient, Dr. Berndes? Good. Remember, this patient has traveled halfway around the world to come to Duke Spine because we're the only ones in the world that do this laser disc repair, the Duke laser disc repair. It's a very special procedure. It was developed here by me, the founder, Dr. Duke Majin, and we've been doing it 16 years here. I learned the basics from the Koreans, German, and Dr. Anthony Young on endoscopic surgery. Okay? They were taught by Dr. Parvis Kambin. He was Iranian, an Iranian orthopedic surgeon who was a faculty professor at Pittsburgh. He was a brilliant doctor. Parviz, P-A-R-V-I-Z, Kambin, K-A-M-B-I-N. He is the founder, pioneer of this endoscopic transforaminal lumbar surgery. Now the Koreans were the first to do cervical, anterior cervical transdiscal, which I learned from them and I made better. And of course, we're the first to do thoracic transforaminal endoscopic here at Duke Spine, myself. And I'm sorry I didn't show you the nerve root on the last one. I realize that now. Let's see if I can show you on this one. So, grab her. Just remind me before I finish. We used to look at the nerve root a lot, but the problem is that it's usually buried in fat within the foramen. Always has fat covering it, so it's hard to see it. You just know where it is, but it's covered with fat. And the reason the fat covers it is it uses the fat energy to do its work, right? Because what we're seeing in the nerve root right there is something called the dorsal root ganglion. It's a collection of somatic cell bodies of neurons. It's the most metabolically active part of the neuron is the soma, where the cell body is. It's where all the protein production, neurotransmitter production, it's where all the energy is produced. It's where all the Golgi apparatus, endoplasmic reticulum, ribosomes making proteins for the cell. That's where it is, right there, right here, next to our tube. And it's the cell bodies for all these sensory nerves from the lower extremity. So anytime something touches your skin and your leg, that impulse, that signal is transmitted along the axon from down by your skin where your ankle is all the way up to the spinal cord, and it synapses, the nerve synapses in the spinal cord, in the lateral column of the spinal cord. Okay? And if it's a proprioceptive input, like position of your joint, like your toe, is my toe up, is my toe down, is my pressure on my foot to the left, the right, all this, what we call proprioceptive information. It goes through the dorsal column, medial lemniscus pathway, dorsal column, medial lemniscus. But if it's the pain and temperature signals, then it's transmitted through the lateral columns, okay? Lateral spinal thalamic tract, it's called. So all these signals from the legs, from the skin, whether it's discomfort or it's touch or it's discriminative touch or coarse touch or pain and temperature signals, proprioceptive information about position of joints, it all goes through this dorsal root ganglion, right? So that's a very, very metabolically active, high need of energy for its work. That's why there's so much fat around it. It uses fat, fatty acids. You know, most tissues in the body can use fatty acids instead of glucose, except your brain. The brain cannot use fatty acids. It must use sugar. How dare you? All right, this is the last of this herniation. We're almost done here. A lot of scar tissue. See it all? All that stuff, the white stuff. Bad, 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 bad. Scar tissue. Here's herniation. So I'll show you the nerve root this time. Again, we're at what, L3-4 now? Luis? I'm looking laterally, by the way. I'm looking to the outside, side of the disc. Okay? Most doctors don't know to do this. They're not comfortable doing it. This is scary for them because they don't know what they're looking at. But I've been doing this so long, I know exactly what I'm looking at. This is the annulus lateral to the annular tear. And there is still herniation, but it's gone now. Okay, let's see if we can see the nerve root. That's it right there. But it's still covered in veins and fat. See all the fat around it? The yellow stuff? See the veins? So much circulation there because it needs a blood supply. And we've gotten all the herniation out. You can see the tear where the herniation came from. So it's, look how big it is. It's small. You guys see what I'm talking about? The tube held it open. Laser. Just a second. But it's already closed up because the laser cleaned it, debrided it, and that allowed it to close. So I want you to take notice. This laser fiber is 1 millimeter across, right, Luis?
Yes.
So right now the hole is 1, 2, maybe 3 laser fibers. So 3 millimeters. So it went from being a big hole to 3 millimeters. Okay, and it's going to close nicely. But right now I need to clean up and let's get out of here. There's some veins in the epidural space. Oh. Sorry. Great questions from the audience. We're done with the disc repair. Next will be the Duke plasma rhizotomy. Thanks, Louise. Any questions? Let's show the audience how this DLDR procedure works with our animation video. What are we doing with the laser? Eventually we'll have a DPR video, but not yet. Very soon.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Shot. Okie dokie, look at that. Got it. That's perfect. So I'm on the transverse process. Go ahead. We're going to be going down to the transverse process. That's the transverse process of L4 on the left. And we're going to basically deaden the pain nerve. I mean, for lack of a better word, we're going to burn the hell out of the medial branch of the dorsal ramus. That's what it's called. the medial branch of the dorsal ramus. And basically what it means is that the only reason you're feeling pain from your facet joint, Coker, is because there's a little nerve that takes the pain signal from the facet joint shot and transmits it to your brain. And that little nerve has a name. It's called the medial branch of the dorsal ramus shot. Perfect. And see where the tip of that is? It is literally sitting perfectly where that nerve is. Yeah, right there where the arrow is, okay? That is the spot. And every pain doctor in the world that does facet joint treatments, MBB, RFA, they're after that exact spot. Well, so are we. Except we use a new technology that hasn't been used here before. And we are going in and basically killing the pain nerve with this new technology. Shot. Permanently. Shot. So our patients don't have to keep coming back, getting this treatment over and over again, like you have to do with your pain management doctor. After all, who wants to have to keep coming back and getting pain management over and over again? Nobody. All right, we'll take the questions.
Next question comes from someone else once more on YouTube. And they said, I saw many surgeries like yours online without laser, of course, but no one makes so much of a clear job. The laser makes an amazing difference.
Thank you so much. I agree. I appreciate your comments. I love hearing from my viewers who actually care, because when you actually care about what's happening, you think through it and you understand it. You take the time to understand it and make a real opinion about it. That's your own opinion, you know. Honestly, you get the facts and you make an educated opinion. Shot? So I appreciate you saying that. All right, so what I'm looking for right now is the L5 junction of the transverse process with the superior facet. That's it right there. I can feel it. Shot? Yep. I'm a little bit medial, but I can feel the bone. All right, there. Let's see. I'm looking for that spot. Let's try that. There it is. So I'm on the bone. I can feel it. And, you know, there's something called parallax with the X-ray where it doesn't give you an entirely clear picture of everything happening. But you have to reconstruct, shot, in your mind three-dimensionally. And I've done that at L5 here. And I know we're sitting on that bone, the transverse process. Let me see, shot. All right. So not bad, I can feel it with the tip of the probe. And this is exactly where we want to be burning. Shot. Can you guys see the right where the tip is? And then to the medial to that, there's the pedicle. Show them the pedicle. And literally, we're right where we want to be. It's just lateral to the pedicle. Shot. Right on the transverse process. All right, we got one more to go on this side, and then we've got the other side to do. I'm going to try to get it from here, but the angle is a bit steep. Let's see, shot. Shot. Gosh, that's perfect, huh? Doesn't get any better than that. Getting lucky, I guess. But that's the spot. Jordan, show him the spot right there. Take a shot. Yeah, literally a little bit superior to where I am. Try that shot. That's it, right exactly where that tip is. You guys see that tip? That is where the nerve lives. It is a bad little nerve, naughty little nerve. And by killing it right here permanently, which I'm doing, it should take his pain away permanently. All right, I'm going to the other side. We're going to do the right side next. Again, you're seeing the new evolution in radiofrequency ablation, except we're not doing a radiofrequency ablation. We're doing a Duke plasma rhizotomy. We're not using a radiofrequency ablation. We do have radiofrequency ablation here. We have how many radiofrequency ablation machines, Luis? 3 of them. 3 of the best in the world. But they do the same as everybody else. They only work temporarily. And then the patients come back. We're there. They're back again. Within 3 months, 6 months, their pain is back, and we have to do it again. So our results with radiofrequency ablation are no different than everybody else's. They don't last and they don't work that well. But that's when we started to think, how can we make this better? How can we improve on the outcome? Give the patient better relief and more permanent relief. And that's when we developed what's called the Duke plasma rhizotomy, which is what we're doing now. And to be honest with you, it's a modification of a technology that I've used for years in treating patients. Shot. And it's not too complicated. Shot. And it works very well. Proof's in the pudding, I always say. Right, Dr. Berndes? Proof is in the pudding. So we're starting on the right side. We're starting at L4. Huh?
I need the sugar-free pudding.
The sugar-free? Shot? I feel the transverse process. I'm sitting on it. Like I literally, you have to feel it under your tip of your probe. As long as you do, you're good. Remember, you're working around nerves, so you just have to be super careful. And that tip is right where I want it. I'm literally right on the transverse process facet. I think he's going to be very happy with the pain relief he gets. All right, so we're going to go down to the L5. Shot. Perfect. I don't know. Honestly, you think Patel gets it that quick? He's fast? Faster than me? I don't think so. I don't think so. Luis, I appreciate your loyalty to Doc. He's being loyal to Dr. Patel. He says Patel's pretty quick. By the way, quickness, folks, is a sign of accuracy and confidence and competence, which, yeah, right. He has been doing facets for how many years? So, I'm not bragging or anything, I'm just poking fun. Shot. All right, look at that. Huh? Huh? Shot. Dígame, talk to me. No, you can't tell me Patel can do that. I think we're just about done. Shot. You see where the tip is down there, guys? Jordan, show them. That is the S1. They call it the L5, but it's really the sacral part of the procedure. And that's the right where the nerve is. Great job, everyone. Thank you so much. You all did wonderful. You've just watched the most advanced surgery in the world for facet pain. This is going to spread around the world eventually. We just have to get pain management doctors to do it. The problem is, once you do it, your patient never comes back, so they're not happy about that. They want the patients coming back and spending more money with them. So these treatments we do at Duke Spine are permanent treatments, fixing disc pain, fixing facet pain, fixing sacroiliac joint, now fixing knees, knee pain, but it doesn't make doctors happy because they rely on patients coming back to make more money off of them, okay? Typical pain management patient will come back to the pain management doctor 20 times for 20 different treatments. Think about all that money that the doctor makes, you know, with each visit. And then that's going to go away because these patients don't come back. All right, EBL, I want to call it 1 mil. No complications. We did a DLDR, left, L3-4, 4-5, and a right, sorry, and number 2 we did a DPR, bilateral, L4, 5, S1. Okay, type up your questions for me. I will answer them for you in a few minutes. I'll do it face to face. See you soon. Thanks, Henry. Thanks, everybody. Great work.
Hello, I'm Dr. Ara Jigmejian at the Duke Spine Institute, and I'm here with one of my patients who's just came in for a checkup today, and she had the Duke plasma rhizotomy. This is a new type of rhizotomy being done to treat facet joint pain. I say it a lot, but the most common cause of back pain and neck pain is a herniated disc. The second most common cause is a arthritic facet joint that's painful. And the standard treatment these days is something called a radiofrequency ablation, or RFA rhizotomy. The problem is that RFA rhizotomies don't deliver very much energy to the facet joint. So if they get the nerve, usually it's temporary and the nerve just grows back. We figured out a way to deliver more energy through what's called a plasma rhizotomy. It's a Duke plasma rhizotomy, and you had it done about a week ago. How do you feel today?
Amazing.
Yeah?
I have zero pain. So
And what did you say to me earlier? This is the first time you've been pain-free in
years.
years. How many years have you been dealing with back pain?
Yeah, probably 10.
10 years.
It's been a long time.
And
yes.
you look very happy.
I'm very happy.
Now, you did have the RFA. It worked for, gave you some relief for a little while, then the pain came back. And this feels different though.
This feels different, as in within 2 days I had zero pain.
It's awesome.
And now here I am a week later. I can run a marathon, I think.
Good.
I
Well,
mean,
we
I
want you
won't
to.
yet, but I can, so.
All right, and there's millions of people out there, and that's why we do these testimonials, really for them, not for me, not for you, but it's to spread the message of hope that there is a way to get out of back pain. You just have to stick with it, find the right place, get the right procedure, and eventually you can get there. And what do you say to that?
I say you're correct. That's Duke Spine Institute didn't give up on me. I've had several procedures, but you kept pursuing my pain until you figured it out. So thank you very much.
You're welcome. My pleasure. Anything else you want to say to your fans out there?
To my fans, come see this man. He is amazing. Duke Spine Institute staff is amazing. Everyone treats you with respect, and they listen to you. That's very important to me. So I just want to encourage people, don't live with the pain. Please come see Dr. Duke and Dr. Patel at the Duke Spine Institute.
I appreciate you saying that. The lesson here is don't give up on your pain.
Yes.
There is a way to fix it. And a lot of patients, probably about 25%, end up having more than one source of back pain. And we have to treat each source because each source requires a slightly different treatment. The rhizotomies definitely were what you needed, but you needed a rhizotomy that worked well because of all the inflammation of the facet joints and the scar tissue. And the plasma rhizotomy is the most powerful rhizotomy that can be done. It's only done at Duke Spine Institute. So congratulations on your new lease on your back. All right, let's get you out of here. I'm Dr. Ari Duke-Majan at the Duke Spine Institute, here with a patient from Virginia who came out to the Duke Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Duke here. And I started watching his videos and testimonials, made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs, and within 2 days, I did my virtual consultation with you. And 10 days later, I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just, I'm back to recovery,
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Duke laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain, pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night, we realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually one or two Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Duke any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. And good morning. I'm Dr. Ara Duke-Majan here with one of my patients who traveled from Hawaii, the beautiful islands of Hawaii, to Duke Spine Institute. You just had surgery for your back yesterday. How do you feel?
I feel surprisingly really good. Almost like nothing happened yesterday.
Yeah?
Yeah.
All right. Well, you came here with a lot of back pain. Is that back pain still there?
Yeah, 7 years back pain. One spot in particular, my right side, that pain's been there forever. A lot of pinching, hard to do things, and it's gone.
That is awesome. So what kind of things, you said hard to do things. What kind of things were you limited with your back pain? What did it keep you from doing?
10 push-ups, I'd be sore for a day. 20 push-ups, I'd be sore for 2 days. General work around the house. Anything that was active I used to do, I just completely stopped. Stopped yoga, stopped surfing, stopped working out, stopped biking. I could swim a little, but other than that, I just was debilitated, depressed. Yeah, felt pretty hopeless too.
And you had prior surgery, and that didn't work too well for you.
3 years ago, in 2019, I had surgery and I never got relief.
You had a microdiscectomy, right?
I had a microdiscectomy. It was about a 7-month recovery. Couldn't get out of bed for about a week. Staples in my back, and it just didn't relieve any of the pain.
Yeah.
It was always still there.
And they don't. That's why we don't recommend them. And so how is the Duke laser disc repair surgery? You could see in your video that we brought the laser in through a tiny incision. It was just 7 millimeters. And we used the laser to clean out the tears and inflammatory tissue. You could see some inflammatory tissue, the red stuff, pink stuff there. That's where the pain was coming from in your disc. We cleaned it out, and we also did the Duke plasma rhizotomy for you. And how do you compare the surgery you had yesterday at Duke Spine Institute with what you had before with the microdiscectomy?
Night and day. It went from like this giant kind of hospital procedure that just lasted for, it was just, it's hard, it just took forever from start to finish to getting approval to getting in there. Whereas here, I flew in the day before, did a pre-op, came in for surgery. I was out of here by noon. I think I was out of here by noon. I'm here the next day. Today's the next day, and I feel surprisingly really good.
When did you start getting up walking after your surgery we did yesterday?
I think I made a couple silly jokes, if I'm not mistaken, to the nurses, and then once the medicine kind of wore off, I was walking, not sure, probably within the hour.
Yeah, within an hour you were walking around.
Yeah.
And you probably walked at your hotel in the evening after your surgery.
Absolutely.
Yeah, because it was a tiny 7 millimeter incision, that's all. No damage to your body inside. Anything you want to tell us about what your plans are now going forward, now that your pain's gone?
Well, the recovery procedure still takes some time. You got to be careful with your body, know your body. I have directions from you on exactly what to do. It's just, 7 years of I almost feel like an expert in the industry of trying to figure out how to fix things, and in one day I feel more relief than I've felt in years. And what I would say was, maybe at least you do free MRIs, don't you?
Free MRI review, yep.
At
We
least
do that online.
let the team take a look, and let the doctor take a look at your back or your neck, whatever it is that's ailing you.
Yeah, and you traveled. It's a long trip from Hawaii to Florida. How long of a trip is that?
It took me about 18 hours to get here. Layover in LA, layover in Atlanta. That actually was hurting my back. Sitting, you know, that's a tough road, so, or tough flight, but worth it, worth every penny.
Anything else you want to tell your fans out there?
The only thing I would say is just pick up the phone. I would say at least give it take a look, because, you know, he does amazing things, and if you get on his YouTube channel, you'll see all the testimonials of what got me to do it. And
hundreds of testimonials.
Hundreds, yeah, of testimonials. So. That's
And
all
we
I would say.
broadcast our surgeries live so everyone can watch it. So
I already watched my surgery. I posted it on Instagram. But thank you, doctor.
Congratulations.
Yeah, thank you very much.
Yeah, it's my pleasure.
Yeah.
All right. Let's get you home.
All right.
How long are you in Florida for? Good morning, I'm Dr. R. Dugmajian. I'm here with one of my patients who has traveled from Wisconsin. She came to Duke Spine because she was having problems with her lower back. You want to tell us a little bit about your back problem? Okay, great. I'm glad you had an opportunity to meet with one of our patients who had the procedure done. And this patient's surgery was done to eliminate back pain. And the back pain that this patient had is coming from two discs, the L3-4, L4-5. They're herniated, degenerated, as well as the facet joints on both sides at L4-5, L5-S1. So we did the Duke plasma rhizotomy, bilateral 4-5-5-1 for facet pain. We did the Duke laser disc repair left L3-4, L4-5 for disc pain. And everything went well. He's in the recovery room. He'll probably be heading out in about an hour. It's outpatient surgery. It's done at Duke Spine. People travel from around the world to come here to have it done. We have questions, so let's take them.
This first one comes from Trust on YouTube.
Hello, Trust on YouTube. Welcome to our live stream again.
They ask, with the knee surgery you do, will it work for the narrowing of the cartilage? I think it means the DPR knee surgery.
Yes, so great question. Duke Spine Institute is now expanding our offering to treat painful knees. And painful knees fall into two categories: those that need some physical therapy and shots, and those that need surgery. If you have a knee pain that needs surgery, you're most likely going to be recommended for a partial knee or a total knee replacement. The Duke plasma rhizotomy can now be done for those patients that have knee pain that's chronic, more than 3 months long, that has failed conservative management with therapy and shots. So in other words, you've tried a shot, you've done therapy, and you're having daily knee pain, it really hurts. Instead of getting a knee replacement, we can go in 15 minutes with 3 little cuts. They're 3 millimeters each. Okay, and we go in and we kill the pain nerve to your knee joint in each of those 3 spots. There's actually 5 nerves. We hit all 5 nerves with 3 cuts. It takes 15 minutes. You're asleep for it with propofol. You go home 20 minutes later. The pain is gone. Everybody that's had it done has gone back to work the next day on their knees all day long, and they have no knee pain that they had before. It is, I don't want to say miraculous because it's not miraculous, but it is a huge improvement over what we've had available up to this point, which is knee replacement. So it's basically going to put, I think it's going to put the orthopedics out of business, about at least 50% of them. It's worth traveling here to get it done. This patient here, as a matter of fact, that we're talking about, his wife is traveling right now on a plane to come here to have her knee done on Thursday, I think, or Wednesday. I think she comes tomorrow. So she's going to get it done tomorrow or Thursday. So yeah, it's worth it. I mean, if you have daily knee pain, you've been thinking about getting surgery done, don't do it. Come here and get the Duke plasma rhizotomy. Next question.
Next question comes from Kit on YouTube. Last but not least, and they said hello.
Kit.
Kit. Like the,
I remember Kit from Night Rider.
Night Rider. Yeah. And they said, hello, I understand that DLDR is covered about 1 of 10 patient
Yes,
PAT,
that's correct. From insurance.
Yeah, from insurance. Oh yeah, okay. How about DPR? Will Anthem Blue Cross Blue Shield cover DPR? If it is covered, what's the rate? 10 out of 10 patient coverage?
Great question. So the Duke laser disc repair is going to be covered far more than 10%. The one insurance we're not comfortable with yet is Medicare. Obviously Medicaid follows Medicare, so those two. But with commercial insurances, we believe that they will pay. We have to fight them to get them to pay. Currently, they're paying 1 out of 10 without us fighting them, but the other 90% we're going to have to fight. And I mean appeal letters, denials, and then possibly litigation. So we feel very confident with Duke Laser Disc Repair that we should be able to get those claims paid because we have strong evidence that Duke Laser Disc Repair works and it's been peer reviewed and published. Plus the procedure is all FDA approved. The Duke plasma rhizotomy, on the other hand, we don't have any of the evidence that we have for the Duke Laser Disc Repair. We've not done a peer-reviewed publication. We just have experience with these patients doing the procedure, seeing them 100% pain relief. So what we need to do is we need to go back and gather all their charts, go through their pain relief that they've gotten, quantify it, quantify their outcomes, basically their complications, if there are any, which there are none, and then how much pain relief they got. And we need to put it in a manuscript, write it up, submit it to a peer-reviewed journal, and then have the pain doctors review it and then publish it. So we're, probably a year or two away from having peer-reviewed data supporting the Duke plasma rhizotomy to be able to get insurance companies to pay for it. Now, that said, we do have insurance companies paying for the Duke plasma rhizotomy. However, most of your commercial plans like Cigna, United, Aetna, they don't pay for it yet. And we don't expect them to pay, and we won't tell you they should pay. And they should pay, but they probably won't because we don't have that data yet that they're going to want to see. So I would say the chance of getting the Duke plasma rhizotomy paid is far less than the Duke laser disc repair, just being honest. But someday when we tabulate the data, submit it for publication, peer review, publish, then we have something to fight the insurance companies on their denials for. That said, it's still worth getting it done. It doesn't cost as much as the Duke laser disc repair, it's far cheaper. However, it's totally worth it to get out of facet pain and not have to keep coming back getting rhizotomies or fusion.
That is it.
All right, I hope you enjoyed the surgery. We're done with questions and answers. We will be back for one last surgery today. This next patient comes to us from Texas. Thank you. It's the end of the day. A little tired, but Texas. And we're going to be doing the Duke laser disc repair, 3 discs, and we're going to do the Duke plasma rhizotomy with 2 facets on the left side. So 3 discs, 2 facets. Hope you join us. That'll be in